anytime that we're open. And they can actually request to get KI for not only themselves, but their family. So we do monitor the addresses and what has already been given out to residents who come in and visit the health department. In addition to that, there are some areas that we've already pre-distributed the KI just so we would have it readily available if we needed to. That would be areas in the 10-mile EPZ that have our childcare centers, our school. We do have an elementary school that is very close in proximity within the 1 mile of the nuclear power plant here. So that is something that we've already done. We've also made sure that the hospital and a few others in that general vicinity are ready to be able to administer KI if we need to have that. One of the things that we are working on right now is providing some education, but also thinking about some avenues of making sure that individuals are aware of what KI is responsible for. Many may remember when, unfortunately, the war started in Ukraine, there was a lot of talk about the anti-radiological or anti-radiation drug. That is what they're referring to as KI. So there's been a lot of confusion about what KI specifically is geared for. So that is something that we're really wanting to take a look at this coming year to really hone in on more the facts and kind of getting information out to the public about why we administer KI, when would you need it. So it's really been a big push for us here about making sure individuals who are coming to the area know about the nuclear power plant first. That is one thing we're also finding out is a lot of our real estate agents are not forthcoming with some of that information. And so we are wanting to make sure that we have that information readily for people who are moving into the area who act like they don't know that we have a nuclear power plant. So that is one area that we really focus on. Our focus is on KI administration to the general public. There is KI that is also given to our first responders if we feel like it is needed. And however, we are the ones who actually would say, yes, go ahead and administer it. Our local health director would be the one to make that call. Now, we always do things simultaneously with our state, so it wouldn't be something where we're just making that call without having discussions, really talking about the benefits, making sure that we have all the information before we say, go ahead and administer that KI. With that being said, our emergency managers department has our rep planner who's already started putting packets together for the emergency workers that would also have their KI. So as soon as we are able to say, please administer it, those workers would already have that readily available to them. So that's kind of where we are with the KI right now. One of the things that I will tell you that we are doing this year is really doing a big push. There has been a lot of conversations over the years, and doing this work is, should we go ahead and have it pre-distributed out in the community so people have it? Should we hold it? And so there's been a lot of conversations about what would be the best thing, because certainly KI, hopefully we never have to use it, but there are expiration dates for KI, and that is something that we also want to make sure that people are not just holding it or they forget about it or they move away. So those are some things we are working through as a agency, as well as our partners with emergency management, about what would be the best thing, because we are substantially growing. And so we want to make sure that we have enough for our reception centers, as well as just in general, if something like that would require us to administer the KI. Does anyone have any questions about that?
Diana, okay, so I probably know the least about radiation for anybody on the call. I was really interested that you said that the KI is only good for one type, right?
Correct.
So would you expand on that just a little bit more, just for my education?
Sure. So there are different isotopes when you're talking about radiological. And so one of the things that has always been kind of I don't want to say a myth, but it's just a kind of protective that everyone thinks that the all isotopes that may be in a plume or kind of dispersed from some kind of radiation meltdown would have the isotope that actually affects your thyroid, because what Ki actually does is protect your thyroid. So that is something that we kind of try to make sure that people don't know, that this is like, oh, any type of isotope, it really does have to be that specific isotope that impacts your thyroid that we would actually want to focus on. And Sam, to go a little bit further with that, one of the things that we do actually, or the recommendation for Ki is really for anyone under 40. The really big push is making sure that our children are receiving the Ki, because that's where they are, still developing and their thyroid and being protected. So that is something that is a true recommendation of using it, is really geared for children and pregnant women. However, we do also in the state of North Carolina have it to where we do offer it to anyone, just because we want people to feel like they are being protected if that isotope is released.
Thank you for that. That was a great explanation. I appreciate it.
Sure. So one of the other pieces to us as public health that gets a little confusing, because emergency management is normally who runs our radiological programs in North Carolina, is our community reception sites. Community reception sites are actually oversaw by public health. One, the reason why it is looked at as a responsibility for us is our main focus and mission in health departments is to protect and keep people safe. So we are actually responsible by legislation to oversee the community reception centers. The community reception centers that we actually are talking about are if there is someone who needs to be what they call decontaminated from a particle, they've received radiation. We actually do what we call a decon. And so with deconning, that is something that we are responsible for, and doing population monitoring. Population monitoring is basically what it's saying. It's going to be monitoring the population. So when people come to what they call the community reception center, they're actually going to be decon from any contaminants that they may have been exposed to, depending on the path of the plume. And when we're talking about this, we're talking about a plume that has come from a release, has gone over a community. It could be a very big release. It could be a very small release, but it's moving over a community where those isotopes that are the particles from radiation that come into the air and all, they go and kind of disperse. That is what we're talking about when we talk about contaminants and population monitoring. So we actually would make sure that individuals are monitored if they are contaminated with any kind of particles. We want to make sure that we get them through deconning. Now, there's two different kinds of deconning that we are looking at. One, which is what most people are doing, is when we monitor, we don't know if that's on their clothes or if it's an internal ingestion from that particle getting to them where it's inside. We're not going to know that until we do a first level of deconning, making them go through. They basically strip down, go through the decon system. We then check them again to see if they are actually removed of those contaminants. If they are not, we would actually send them back. But if the second time comes around, what we are considering that is an internal contaminant where they would actually need to be seen by a medical provider. So that is something that sometimes is a little tricky, because when you are doing population monitoring and using our monitors, rather the porta monitors where people are walking through it, or even the wands, the pancake ones, we actually don't know where exactly that contaminant is right after the on that individual. We won't know until they go through deconning and have that second monitoring to know if they have been, it could be on clothes, could be on their hair. It's that second deconning that really helps us know where maybe those contaminants were on that person. That is something that we would not have the medical provider there just because of us being a health department. We don't have that capability. They would actually have to be then transported to the hospital if that is something we're thinking. Once they go through the deconning, then our reception sites are actually here in Brunswick County, our shelters as well. Most of the communities that we serve, the shelters, they're kind of used to that process, but it would be different because they're coming through the deconning before they would even be able to go to the shelter. So it is set up a little bit different than our typical shelters. But what's nice in our county is our schools are actually what we use. And so that is something that we really want to make sure that people are aware of what reception site they would need to go to. We actually have 2 in our county that sit outside the EPZ. In addition to that, one of the things that we are working on is thinking about maybe having a host county more inland that could also open up a reception center. This is in the very early stages, but one of the things we're talking about is maybe also having another county that could be there, because most of the time, if we are talking about a radiation release, people have seen Chernobyl, all these different things that are on TV. So there's a notion already and a fear that goes with a radiation release to where people may not want to stay in the county. They would want to get further away. So that is something that we're looking at, is maybe also having that as a possibility for people to, if they're continuing to go, they have another place that they can stop and actually get decon. Not everyone, when we have talked about this, feel like it needs to be right outside the 10 miles, but we also don't want people going so far where we don't know if they're contaminated or not, and they continue to go and be spreading that contaminant to other places. So that is one of the reasons why most of your reception centers across the state that have the nuclear power plant, their reception centers are pretty close outside of that, because we really want to try to keep as much of that contaminant in kind of a closed-in area than having it spread all over. And then we're doing even more decon that we really don't want to be doing, because it's very time consuming. But that is something that we are also looking at for us, just because we do know that fear. We do know that individuals may not feel comfortable with staying in the county. Even though there's a lot of great resources out there talking about what, radiation and the nuclear power plants and all the barriers and things that they put in place. It's just people have seen a lot of things that have been online, and so they tend to not want to stay too close to the area. So that is something we're in the process of, but it is a oversight that we would be seeing in our county. Currently, our health department has 83 people, and that's everyone from our WIC department to our clerical staff. In order to run our 2 reception sites, we have to have 96 people. So right off the bat, myself and our rep planner know that we do need to increase our personnel to be able to make both of those reception sites happen. That does not include staff that would also need to be helping in our shelter. Our shelters are run by the Department of Social Services, but the medical support in all shelters, especially here, are from public health. So if public health is focused on the decon, we really don't have anyone that could help from the medical support in the shelter. So that is something we are looking at currently, is going ahead and building in a personnel surge. Another piece to the reception sites that we are already been working on, and now that we have a dedicated rep planner in Brunswick County, which is very nice, that we finally have been able to get that position filled, is looking at also having medical scrubs, some kind of scrubs that people can have once they do have to go through deconning, because of course they can't put back on their clothes. So that is something that we are looking at, is having some memorandums of understanding or agreements in place with some uniform companies, different places throughout the areas, that we would be able to also provide scrubs and something a little more comfortable for people to be in after they go through this process. With deconning, we also think about our animals. Most people in our world, and I think everywhere, pets are our family, which certainly is true. And so one of the things that we really want to make sure that we're focused on is making sure that our pets are also taken care of. With the pets, we do also decon as well with them. Service animals would stay with their individual, but we also practice pet deconning for people to be able to make sure that their dogs and cats are safe. If it is larger livestock, because we certainly understand that we have individuals that are farming and have their cattle, their different herds, we do work with our Department of Agriculture and Cooperative Extension to make sure that the farming community would also have what they need during a time of a radiological event, to make sure that their animals are protected as best as they can be. Our shelters, unfortunately, can only accept dogs and cats, but it is certainly for most people who they're going to be taking to the shelters. We have seen that through all of the hurricanes that we've been through, is a lot of people will not evacuate if they can't take their pets with them. So we want to make sure that it's as, conducive for them to also be able to have their pets with them if we needed to open our reception site. So that is something that's also set up in deconning as well, is making sure that, because pets can also have contaminants. Now, one of the questions that I have gotten asked before is KI something we would also want to give our pets? No. KI does not do anything for our pets, but that has been a question. Do they need something to also be able to protect them? And really right now, the deconning is the best thing. We just recently went, and there's a lot of ways that you can decon a pet. Basically, it's running them through a bath. But that is something, if they're a smaller animal, cats are not really bathe worthy for the most part, but there are wipes, there are different things that we can actually have for individuals to be protected when they come in and get wiped down. That is something that we also have everyone do. We do have, right now, the 2 reception sites will be equipped to monitor, as well as doing pet deconning. We are in the process of getting a lot more equipment needs because of our not only just personnel, but also our surge in our residents. We are one of the fastest growing counties, so that is something that we would have set up. Now, most of the time, your pet deconning and your human deconning are going to be separate, but that is something that we are offering, since all of our shelters, regardless, are co-located. And that's kind of our role and responsibility in the reception sites. Certainly anything else that we can participate in, we do. One of the things that falls underneath public health, what we do not administer it ourselves. Some health departments do, some don't, is behavioral health. So mental health is something that we can also coordinate and facilitate if someone is needing that in a shelter. And so we're using those same premises when we also are going to be doing with a reception center, is going ahead and having mental health therapists, individuals there on site to be able to have conversations with not only just the individuals that are coming to the reception center, but also looking at having some for our first responders as well. This could be a very traumatic time for everyone. I don't see any way around it being traumatic. So those are some things that we already are working on, and making sure that a lot of the things that we do for our shelter, we also would be making sure that it's readily available for individuals if we have to open our reception sites as well. Do people have questions about any of that? And let me see, I think there's some questions in the chat, so hold on one
I,
second.
I had just a quick thing, and I know Diana, you and I have kind of talked about this before, but like when you were talking about that Brunswick County doesn't have the staff for the reception centers, like even starting out the gate, you're already short staffed. That we're of course hoping that this is where REVC can help out in the county.
Yep.
So we have all done some reception center training and pet decon. So I'm really hoping, you know, it would be awesome to do like an exercise where we were all in the same place at the same time and practicing this.
No, Sam, and I know we've talked a little bit about this just because we were trying to get our numbers. And like I said, it has been a great relationship that we have with New Hanover, because we actually rate our radiological plan with New Hanover County. Brunswick County does have the nuclear power plant here in our county, but it does touch New Hanover. So now having a dedicated rep planner, that is some of the stuff that we were looking at, is going ahead and figuring out how many people do we really need to run that, and
That's
knowing right off the bat that we're going to need to do personnel search is exactly what I think we can certainly do. For your information, and we're going to be doing that. We will be running our reception site. That is going to be coming up for the FEMA graded exercise.
Oh, good.
In addition to that, one of the things that Brunswick County and all the health departments have done this year is we have done a jurisdictional risk assessment. It is really, ours is geared about where we feel like we have some gaps and need some improvement. And one of the areas identified, of course, were our hazardous release, which included radiological. So because it has been identified as one of our priorities for our jurisdictional risk assessment and our integrated preparedness plan, we will be using that as the full scale exercise that I have to do from the health department side. So once we kind of have some more dates, I would love to be able to really bring that in to show everyone, also incorporate our access and functional needs individuals and how we would be deconning them. How are we looking at incorporating some of the same things that we have to do for shelters? So making sure we have, you know, our language interpreters. How are we making sure that we have stuff accessible for our deaf, blind, the populations that, you know, may be coming to the shelter, and how do we accommodate everyone there? So those are some things that I really want to make sure we practice. We just haven't gotten there. It's probably going to be more like 2027 or so. I actually need to follow up with Taryn, our rep planner, to see, but yes, that is something we automatically know is we're going to need more staff just to be able to run.
I guess
so, you know,
saw that question in the chat then, or maybe you just spoke to it, but Angela was asking how the shelters are set up from a decon perspective to deal with children with special needs or individuals with special medical needs. I mean, I can imagine, you know, if somebody comes through in a wheelchair, yes, you can roll the wheelchair through a portal monitor or something, but if they are, you know, contaminated, then showering is going to be a little tougher for them. So, but you gotta do what you gotta do. So
that's right. And so some of the stuff that we do have to already have in place with our receptions, and no, I haven't actually didn't get to all the questions yet. So that's great.
oh, that's good.
That's a wonderful question, because we do have to take all of those in consideration. So thinking about having shower chairs and having components in there, because certainly you don't want someone sitting in a wet wheelchair if they, you know, that's not very conducive for anybody. So being able to have some things that could help benefit them. We do have some of that equipment already in place just because of our shelters, but those are things that we are looking at to be able to have. If depending on the individual and what the needs are, we are, you know, looking at ways that we can kind of beef up what we already have in place just so we can make sure that we are having those accommodations. One of the things just recently we were talking about is working with the state with our deaf and hard of hearing and making sure that we have stuff in place that could help them. We also had our DHHS, the blind side, which they're close to each other, but they're separate programs. Thinking about, do we have stuff in Braille? Do we have stuff that we can really, make sure that we're letting people know? Because we do have a lot of those in our county that may need additional needs that we, may not be thinking about. So that's part of some of the stuff that we're already kind of looking at. We are in a good time because we're revamping a lot of our plans to, kind of make some updates and bringing things a little bit more readily available for like right now, our residents, we're at 167,000. And that's just residents that are full-time to Brunswick County. We're not even talking about if it was happening during a tourist time frame. And could people show up that are tourists that happen to be in the area? They could.
Yeah.
The other caveat for us, which is very unique to our areas across the state, is we have a island that sits out. Bald Head Island is our responsibility, and figuring out what would we do. The best thing that we have come up with is for them to shelter in place because we cannot get them back from the ferry because the terminal is actually in our Southport, which is where it would be the zone. I mean, the main. So those are some things that we think about is what do we already have in place? So we've already distribute KI for them, but those are conversations that Taryn and myself are having with our Bald Head public safety is what do we do and making sure that those individuals are taken care of because they're still part of our residents. And just because they're on an island doesn't mean that they're not part of our responsibility. So those are some things that we are continuing to think about and improve on. I feel like it's always a work in progress, the things that we do. And so I'm really excited about monitoring the reception centers. I think, Sam, you've played this. I don't know if others have, but there is a game. I do have. I do have the game.
I have a copy too.
It's great. It's called This Is a Test. It's a more interactive tabletop to really kind of walk through what a reception center and deconning is like. And it really does help kind of think through some of the stuff. The last time that I played it, I had two of my Department of Ag folks, veterinarians, sitting at the table, and it was nice to kind of go through some things with them because they're thinking from a different perspective than I am. And so that's a really great tool that once we kind of identify some dates, we are going to play that with everyone as well, because not all my staff have actually had the opportunity to play it yet. But it is a great learning tool, and also figuring out where we might have some bottlenecks. Because it's a lot of people that you're going to be trying to get through in a very quick time.
Yes. So I've gotten us away from some of these other questions.
Sure.
What educational information do you have for pet and livestock owners about internal contamination?
So that's a great question. Our Department of Ag handles all of our livestock. There is I will have to look because there is one about pets like dogs and cats that I can see if I can get my hands on it. They were working on kind of doing some updates, our Department of Ag. So we have and I don't really know if they have a specified name, but they're part of emergency preparedness, but in Department of Ag, that's what they do. I can reach out to Anna, Sam, if that's okay, and see if maybe if she has any of that would be great to be able to provide to people.
Last year, Anna and Bruce, before he retired, did a talk for us like you're doing on animals and radiation and stuff. And my understanding, if my memory serves, well, first of all, if you have food animals, like you can't get milk from those cows. You can't eat cows and pigs and chickens and eggs and all that. You can't eat it. But like for our dogs and cats, I think, like you were saying, we don't give them KI. And my understanding, and I used to work in veterinary medicine too, but I'm not a veterinarian. they kind of don't live long enough anyway for whatever issues humans might have to be an issue. Which is why, like you were saying, we focus more on people under 40 because they may live long enough to have an issue. It's not like if I'm exposed today that I'm going to wake up tomorrow and be sick. Like it's something that
Correct.
takes a long time to affect you. And so I think, and my understanding is like with our pets, they just don't live long enough to have that, just their normal lifespan, that it probably wouldn't be an issue for them anyway.
And I know for pets, like if it's talking about dogs and cats, that would be with you. They would just go through the decon like you do. They just have a
Right.
separate kind of area because we
Yeah.
don't want, it's a lot if you're trying to run people through and trying to run their animals at the same time. So we do have a separate area that they would go. But the livestock, there are machines that once they get to a point where they're trying to figure out would like the cattle, basically the livestock that is used for our food production, there are things that they can actually do that they kind of put next to the animal and it can kind of read the readings on the inside to
Oh,
see if
wow.
they have and they talked about this a while back, but I'm not sure what specifically they're handing out to a lot of our farmers. I do know that they do have some things like that because before anyone could even be able to utilize, even looking at if there's radiation and it falls to like crops, they have to make sure that all of that would be something that we could eat. And if it's not, they would work with the radiation protection team at the state and determine the levels. But there are some really little machines that I know that they have now on a normal basis. What they would do is there are recommendations that Department of Ag has already put out. So if there was something like water supply, making sure it's cut off from anything, it's kind of like bottled water that they would already have in place, and the food would be a certain way to help keep the animals as safe, kind of like a shelter in place, but for the livestock. So there are some things that they have learn from other previous situations that they would also encompass with us. But if I find any of that, and I know we have Daniel, the new Bruce, and I know he was working on revamping some of that for us as well. So once that stuff is, certainly readily available, I think that would be a great thing to share with everybody.
Absolutely. Yeah. If you could, anything you find like that, if you'll send it to me, I can disseminate it to the whole group. That'd be
Okay.
wonderful. We also have, well, you sort of touched on this, like what information does the ag department give farmers regarding their crops and how that could affect supply chains? So it kind of depends on the crop, I guess.
Well, it depends on what the radiation protection team comes back and says, okay, these crops are not good, or these things could be, there are certain things, some things you just can't change because it's coming from the sky. But there are levels that they would say, okay, this is not something that could actually be eaten. And between Department of Ag and Health, we can actually do what they call embargoes. And embargoes would actually have us to where we could stop that. Now, if it's a big production, I think it would be something that then would even go higher up to where people, if they lost their crops or their kind of production that day or, that year because of whatever happened. I think it would be like anything else that they would have to fill out the forms and see what they could get reimbursed from a farmer perspective. It is a little bit hard because water and things of that nature, but there are a little bit with crops, not as much. Livestock is kind of more the important ones that they have focused on, but that is something that we do keep in mind and work with the Radiation Protection Agency as well as Department of Ag and us if we need to say, okay, this is not, suitable for ingestion. Those are things that we can do.
Yeah. And so another comment, I know we touched on, it's like individuals with access and functional needs, but someone also brought up autistic children. And like you said, just for anybody, everyone's going to be scared and nervous. And I mean, can you imagine for whether it's a child or an adult with autism that, how scary that whole situation would be? And I mean, do you guys think about that in your planning process?
So part of that is with our behavioral health pieces. There are in our typical, like if we were setting up for a hurricane and opening shelters, we actually have kind of like little quiet areas to kind of help because
Nice.
that's a lot of commotion, and anyone who's you know, maybe severely autistic, a lot of commotion can really set them off to having you know, either an attack. So those are some things that we have talked about maybe also doing because it is going to be a fearful event. And so we know automatically that we have talked about going ahead and getting like Trillium working with us and making, which is our managed care on the eastern part of the state, is making sure that we have already identified behavioral health, you know, therapists that can come in and kind of be there to help people who are just nervous in general. So those are some things that we're thinking about. The decon, it's kind of like getting them in, but definitely during the shelter area, because I say good thing, but the one thing that you don't have to worry about when you're doing a shelter for this kind of component is we're not worried about winds. Unless God forbid it happens during a hurricane, and then that's a whole nother story. But normally you're not in the sense of the same capacity. So areas that we may not be able to use on a typical shelter for a hurricane, we now actually have accessibility to those during this kind of sheltering, because we're not focused on the high winds and things that come from a storm. That is something that will allow us to have a little bit more kind of areas that we can, you know, put people in. One of the things that we also do is have some little activities that we do encourage people to bring things, but you know, you're getting out of Dodge. So we are looking at having some things that just kind of can help people as well, just to kind of manage a little bit of stress through this whole process.
Yeah, that's great. Someone was asking, does the Red Cross not manage the shelters?
So we would take on the shelter at the beginning. Normally Red Cross in our county will only come in 72 hours after we have already started. But with the reception sites and all, you know, we kind of plan for that, but it may be longer that our staff are the ones running the shelters. That is something that we are looking at, because I don't know from, with this kind of situation and having that, how many of them, you know, would be coming into the area, because we're trying to limit. But that is something that right now our shelter stands is 72 hours, reman it, and then after that, the Red Cross can come in.
Tina's asking, what about people who don't speak English? And again, that's with your behavioral folks. Do you incorporate language there as well?
So we actually have, now if it's Spanish, we have Spanish interpreters on staff. So that is something that we already have, but we also have what we call the language line. We have, unfortunately, you know, finding, because it's more than just Spanish in some of our areas. So we do have that we can actually at least put up and be able to communicate with someone. But if they're Spanish speaking, we do have interpreters that are on staff that we can certainly bring in and, you know, have them there to be able to help.
And then people
language line also is great personal.
Sorry, was somebody else talking?
I said language line also has language.
Yes. Great, thank you. And then some folks were talking about this as a test, and that was at the Southeast Conference. It was just at NREP as well. And then somebody put the link to it there, so that's cool. Oh yeah. Jay's saying they have some new add-ons for it too. So
yes, this is the test has the pet deconning now.
Yes. I don't have that
you can have
expansion yet.
No, and you can have the little meebles that are now the pets. So that's really a nice little component. And what I will say about that game is, if you can partner with, because I think we have people across the state that are on this call tonight, but if you can partner with your locals, a lot of us have bought the game. I know emergency management has bought it, but a lot of us from the FEP side, because it came from CDC, we've already purchased it. And I have like the classroom side, so I can run you know, like 4
oh yeah, that's
groups.
great.
And so that's a really nice tool to kind of think through some of this, because as much as you feel like you're prepared, you're never prepared.
Right. exactly,
As much as we wish we were as preparedness coordinators,
right?
there's always things that we learn. And some of that, some of these discussions that we've talked about even tonight were things that we brought up, like, do we already have that in place? And then we were like, wait a minute, we technically do for our shelter. So why don't we expand it to some of the
Yeah.
things that we're thinking about with the reception center? So some of it isn't as much of new things as much of let's expand what we already have. One of the things that we work very closely with, and certainly we do this with shelters, we would do this the same thing as we do have a very active access and functional needs registry. That is something that it is a volunteer base, so you are still hitting and missing some of the individuals that may, not be on that. But one of the other things that we have talked about is in a time of need, and we would actually have to move this pretty fast, but this is a conversation we had after the HAB exercise with our Department of Health and Human Service at the state level. Was we have a thing called Empower data that we can get. It's through the Health and Human Services at the federal level. It's actually the Centers for Medicaid and Medicare that actually have a list of anyone who has any kind of medical equipment or things that may need like oxygen or other components. We can actually get identified information on those people to make sure that we are also, looking at them. So one of the things we have talked about is if for some reason, God forbid, anything like this would happen, is could we also get that to cross-reference to make sure that those people are getting taken care of? That is something that we really want to make sure as well, because it's great that we have the registry and it's very active, but at the same time, we do know that there's people that are being missed by that. And are there people that are on this Empower data that could potentially be impacted because of this situation? And what do we do? And making sure that they are taken care of.
Right. And then we've got some, Angela has shared some links to something from IAEA about assessment of contamination to agriculture, and one from Georgia that was also a rep agriculture booklet. And Andrew is also suggesting the USDA has stuff. And then Tina says that the Price-Anderson Act and the American Nuclear Insurers may cover crop loss financial damage. So, yeah.
Yep, I knew there was some, I couldn't remember what ones, but there were some that they were looking at the financial, impacts, because it would, I mean, this is people's livelihood.
Yeah.
We want to make sure that they're taken care of as well. And so, the game is actually on the CDC website, and I can pull.
The link is here. Somebody already shared it.
Did someone already get that? Yes.
Yep.
So you can actually download the game for free. You don't have to buy. I bought the game just because I wanted the little meebles, like the hard wood, little things, but you can actually print it out, the whole game online. And, that's a great tool to have to be able to at least start having discussions with individuals. I know a lot of people are starting to use it to be able to play and kind of have those discussions, but certainly that's something that, as more people are seeing it and having those discussions, I think it would be really great. And I'm hoping to get the pet side of it. So we do that as well.
That'd be great.
For us, so one of the things that we've talked about is our animal control is actually our protective services. So they would be the ones that focus on the shelters with our pets on a normal day. They would also be the ones that would be helping us with doing deconning. And so those are some conversations that we're going to be having and making sure that they're all, understanding what we're asking of them, what's needed. We've talked about using the Camet trailers that we have for shelters for the cages, having maybe one of those be designated for people who may have forgotten their cage or want something where they can run them through the deconning. That is some of the conversations that we have been having locally just to kind of start this process, because as we start gearing up for doing this full scale exercise, those are things that we really want to make sure that we're looking at and, tweaking. That's why we do these exercises. Right. That there's always going to be things that we can find. I know in the previous couple exercise that people have done reception sites, the access and functional needs has been a biggest thing. that people weren't planning for it, or they didn't have enough people kind of playing into those parts to really show what you would do if someone did have a access and functional need.
Right.
So that is something that, you know, we really want to make sure that we're covering all those bases.
Yeah. Mark wants to know, your 167,000 residents, is that in the county or the IPZ? Or I'm thinking, is it both?
So it is actually the whole county as so we have less than that. We are actually in the process of getting new projections. I have been working with our GIS as well as our rep planner to get projections for the new growth, but we are significantly a lot more than what we used to be in our EPZ, but because of some of the changes with the new zones within the 10-mile, we're kind of trying to see about getting those specifically. So that is something that we're working, but no, that's the whole county as a total. That is not just what's in the EPZ. It's just that if you look at our population and demographics, we are continuously growing, and we are significantly growing in even the EPZ area. So one of the things we've talked about is you can't change the 10-mile. Okay, the 10-mile is the 10-mile, but we may have a neighborhood that is cut in that line, so to speak, that's the 10-mile. Well, I don't know about you, but telling part of a neighborhood they need to go and then another part of the neighborhood doesn't really go well. So we've talked as a county that we would really just encompass that whole neighborhood, because we don't want to have that much of a, you know, oh, well, this, like, why is my neighbor going and I don't have to, but live, you know, a street over. They're not going to understand that. So those are some things that we've talked about, because unfortunately where that line is, there's been a lot of development where it literally cuts like a neighborhood in half.
Sure, yeah. And then Angela has a question. Angela, you want to come off mute and ask your question? Oh.
Well, I have two parts to it. The first part of it was, one, how quickly could you have the KI ready for distribution in within your 10-mile area to your population?
So with us, we have a 4-hour window after someone is exposed. That is the KI recommendation. So right now, our KI that we have for the population is sitting in our pharmacy. And so we would be able to get that pushed out pretty quickly. But it is a very, very tight window, I will tell you. Only having 4 hours after someone's exposed to make sure that they have it. And so that is something that we have just recently ordered to kind of help with some of this and getting it already pre-packaged. So our KI that comes from the Nuclear Regulatory Commission, so Duke, which is our nuclear power plant, and the other nuclear power plants get a certain amount of KI from the Nuclear Regulatory Commission that they will give to us. With that, it comes in like these little, like what you would have, like the pockets that you would have in a nursing home where you're just putting out pills. So we have to have 2 tablets for each adult, because the recommendation is 130 milligrams. But they are already kind of pre-packaged where there's a whole bunch of them all in the same like sleeve. So we actually have to individually put all of those in packets. One of the things that I actually thought about, because when we're giving this out anyways, people put them in like a little plastic Ziploc, and then guess where it goes? The junk drawer. So one of the things that I've worked on is actually getting the amber bottles, because we do provide prescriptions anyways, is actually having a amber bottle, like a medicine bottle that you get. It will actually have the amount. So adults have to have the 130 milligrams. So they would get the 2 tablets. It would have like the lot number. It would have the expiration date, because a lot of this KI is also extended. And then on top of it, it would have the radiological. So that is something that we're looking at going to put together. So everything's kind of ready to go. So if we did have to kind of push it out to the 2 sites, it would already kind of be pre-packaged, and instead of us having to try to do it then, because of how the packages comes anyways, it's just a little bit of a nightmare. But that is something that we've talked about, because it's not send to us in a nice little pretty package and you just hand it out. We literally have to do that as well as print out all the directions and everything for people. And if you're talking about kids, then they also, depending on their size, they either can get a tablet, so the 65 milligrams and meaning their weight, or if they're even younger, we actually were able to purchase crushers. So the schools in them would have things to that nature if we had to administer. And all of our parents at the beginning of the school year get a notification about would they be okay if their kid got KI. They have a slip that they fill out and everything. But yes,
Okay,
it is going to be a little challenging.
So that kind of also addressed a little bit about my second question was you had talked about in the beginning that you had considered pre-distributing it to your population within that 10 mile. And my question was in that was, wouldn't that be a nightmare from not only a tracking perspective from an expiration part, but also, like you said, people put it in a junk drawer or they put it somewhere else, and then you've got to come back and redistribute again. So you kind of answered a little bit. They are trying to address that now with the little amber bottles. So you kind of addressed my second question.
Yeah, and that's one of the debates. We have been going through this debate since I can remember, of like, do you give KI out? Should you go ahead? And, they did long time ago, they had actually set up the KI and try to do the pre-distribution. Unfortunately, people took the KI that day.
Oh, jeez.
Even though they weren't supposed to. So, I mean, following directions is not always something that we see. But that is something that we want to make sure that individuals are, that is a concern. It also is a concern if people leave, then that KI just is gone. One of the things that we're also thinking about is there are, because you can buy KI at the store. I mean, the pharmacy, it's pretty cheap to buy potassium iodide. So that is something that we're also talking about is, if some of these areas like neighborhoods would want to go ahead and kind of have some of it, we're talking about some of those options. So there's things that we are, thinking about. Nothing has been set in stone because they're just kind of first discussions, but that is something that we always have had that kind of, do you give it out? Do you not? What should you do? Because you want people to have it, because I will tell you, a 4-hour window is not a long time. But we also don't want it to where then people don't have, they have it, but then they don't take it, or for whatever reason they forgot it, then they're coming to the reception site and then we don't have it at the reception site because we've done this. So there's been a lot of kind of back and forth. And so a lot of these meetings that I go to, I ask that question because I really am interested what other states and all have done. And most of them do not do pre-distribution. They were okay with like us giving it to the school and things of that nature, but to just kind of set up some outreach events and hand it out and have people sign off that they've gotten it and that kind of stuff, they really felt like was not a good use of the KI. It's better to keep it for the reception sites.
Awesome. Great questions, you guys.
Yeah, I appreciate, because I hate when I'm on sometimes calls and then I'm the only one talking, so.
This is a very interactive group.
Let's
I
see.
think we caught up with everything in the chat. Mark
Okay.
Dalton did mention you can even get KI off of Amazon.
You can. It was like I don't know, a ton of tablets for like maybe $10.
Right.
So
and some of it can be temperature sensitive, like you were
It
talking
is.
about storing. The iodine can be sensitive to high temperature, high humidity versus, and it can change the absorption rate and the affectability, which is also an issue. And my other thing was, because I know I was still in and out of service, for the autistic, they have sensory kits that they put together for those things. If they don't have a specific space initially set up for those families, they give things like weighted blankets, headphones, fidget things. So they have a whole thing. I think when I went through FAST and some other things, they gave us like handouts and stuff
Yep.
That
And that is something that a lot of people are doing. We use that during COVID is having like the headphones and different, and like the little, I call them fidgeters. I don't know if that's the
yeah,
correct term.
fidget things.
Yeah, so just having some things for people to do, and even adults and that just feel like they need something to kind of preoccupy.
We do them in the ER. We have them as well,
Yeah.
just for things like that. So yes, great information. Thank you so much.
Well, and we have talked about, that is something, because where do people mostly put their medicines? They put them in their bathroom. Where do you think the temperature is? It's, so that has been, and I actually had people who were like, yeah, I got KI just so I could have it because they knew they were in the EPZ. Well, where is it sitting? It's in their car.
Yep, in the car, in the
Yes.
glove box, or in
That's right.
EMS
I'm like,
response bag.
And I'm like, no, the heat really does not, this is not a good place. So that is something we've talked about. I asked when I was at the National Radiological Conference, which I was so excited that it was housed here in Charlotte. So kind of our backyard. I did ask, and some of the other states actually do a voucher. So they would come in, and instead of us having it here, they have worked out with a pharmacist that they would just take the voucher to the pharmacist and get their KI that way. But those are some things that I will tell you, these debates continue, because there's always, going to be some other way. But I will tell you, having a 4-hour window and having a lot of people to try to do this with in a timely manner, that is a concern. The other concern for us is we are a very older population. Our average median age is 57. We have a lot of retirees. So, we have people who are ready and they're going to be right there wanting to get their KI. And so that is some of the stuff that we've talked about, is, and some people have purchased it. Some even doctor's offices within the EPZ have purchased it for their patients. So it is something that those who are aware are trying to make do. But that is something that we have talked about is, what is the best protocol. There also were a couple books that I have not had a chance to look at, but they came out during the National Radiological Conference about Fukushima and Chernobyl and some of the stuff with KI. They sounded very interesting to me. I would love to read some of that because it would really be nice to see what other, things and what they recommend or what they think. But that is a lot of the education that we're really feeling like we need to, is that we need to make sure that we are educating our community. Right now, we have a lot of people who are not even aware that there's a nuclear power plant. And they're like, why are there sirens going off? And even though there's education that's been out there, there's obviously still areas that we need to focus on. So that's one of the biggest things that we've talked about, is kind of getting in the forefront, working with communications, really getting people more aware of, what does this mean if I'm in the EPZ, also knowing where the reception site is. Because that's areas, depending on what part of the county, it depends on what reception site technically they would recommend you going to. Doesn't mean that you won't have people who probably go to different, but it would be nice to have, kind of that idea, because if not, you're going to be inundated in one reception site when another one may not. And, it takes a lot of manpower to do this.
Is that 4-hour window, is that across the state, or is that just a Brunswick County thing?
No, that's across the recommendations for KI, from what our pharmacists have told us.
Gotcha.
But great question.
It's been great, you guys. We're just over an hour. Any last minute questions? I don't want to take too much more of Diana's time. She's got to go eat supper and stuff probably, so I want to keep her from that. Any other questions? I think we have hit everything in the chat. Oh, one more thing. Oh, people are just thanking you in the chat, so that's great.
Sure. Yeah, and
I want to
anything,
thank you as well. This has been great.
Yeah, Sam, if there's anything else, I'll be happy to. I mean, this is just
Awesome.
one of the little components of public health. I kind of went towards the radiological since it is
Of
the
course.
REVC.
Yeah.
But certainly we do more than just all of that. But yes, I definitely am happy. And once I get those dates and all, certainly we'll be able to provide that information to you as
Great.
well.
Yes, we would love to come and practice with you. That would be really fun.
Yeah. Oh yeah, I
And
like
educational.
population monitoring.
Yes, that'll be great.
I like the wands.
Yes.
Just tell Jay he has to bring me my wand.
Bring her a wand, Jay.
Hey, I got some new stuff for you to try out.
He says he has new stuff for you to try
Ooh,
out.
I know there was a lot of fun things. And yes, Ferguson, beach trip, come down this way. Certainly, we would love to. And like I said, I mean, that's something, even if people want to just kind of see this, you know, you don't even have to participate. I think it would be
Yeah.
a great avenue. So yeah, once we
yeah.
get more with our rep planner, I'll be happy to share that. But that is my goal, is
Wonderful.
to make it my full scale exercise.
Great. I love it. Diana, thank you so much. This was really great information, and I know everybody enjoyed it. And y'all, if you think of other questions, you can send them to me and I can send them on to Diana. And Diana, if you find any other resources you think these guys would like, if you want to send it to me, I will send it on. Jay's trying to lean in, but the camera's not picking him up.
I'm invisible.
He's trying to, he's like a vampire. He doesn't show up. But yes, thank you so much. I really appreciate your time.
Of course. Well, thank you for the invite.
All right, thank you. You take care. I'm gonna stop the recording.